The National Museum of American History in Washington, D.C., was crowded with tourists, students, historians, and military veterans exploring one of its newest permanent exhibitions. Near the entrance, an 80-year-old man wearing a faded brown tweed jacket, neatly pressed khaki trousers, polished leather shoes, and carrying an old leather satchel quietly wandered through the galleries alone. He paused longer than anyone else in front of each display, carefully reading every description with a gentle smile. Several visitors assumed he was simply another retired history enthusiast enjoying the museum. One teenager even joked, "Grandpa probably remembers when half of this stuff was new." The group laughed and continued walking. The old man smiled politely without saying a word. Moments later, a museum guide noticed him standing silently before a glass display covered with flowers left by previous visitors. She approached and kindly asked if he needed any assistance finding another exhibit. The elderly man softly replied, "No, thank you. I was just remembering." Before she could ask what he meant, the museum director suddenly hurried across the gallery, stopped in front of the old man, and warmly shook both of his hands. "Dr. Jonathan Pierce," he said with unmistakable respect. "We've been hoping you would visit again." The entire gallery fell completely silent. Only then did the visitors realize that the quiet, elderly man they had mistaken for an ordinary tourist was the very scientist and inventor whose groundbreaking work had become the museum's most treasured permanent exhibit. Resting inside Jonathan's worn leather satchel were the original handwritten notebooks documenting decades of research, along with one sealed letter from the mentor who had taught him that the greatest inventions are remembered not because they change history overnight, but because they quietly improve millions of ordinary lives for generations to come. The National Museum of American History in Washington, D.C. welcomed thousands of visitors on a bright autumn morning. Families explored interactive exhibits, school groups hurried from gallery to gallery taking notes, and tourists stopped to photograph some of the nation's most celebrated historical artifacts. The newest exhibition, titled "Innovation That Changed America," had quickly become the museum's most visited attraction, drawing engineers, historians, scientists, and curious visitors from around the world. Quietly entering through the front doors was an 80-year-old man named Dr. Jonathan Pierce. He wore a faded brown tweed jacket over a light blue shirt, neatly pressed khaki trousers, polished leather shoes, and a pair of old wireframe glasses. Hanging from his shoulder was a weathered leather satchel, whose edges had softened after decades of faithful use. Instead of heading directly toward the famous exhibits, Jonathan walked slowly through every gallery, carefully reading each display, as though seeing it for the first time. He occasionally smiled, paused to study an old photograph, or gently nodded after reading a description. A group of high school students noticed him lingering in front of one exhibit for several minutes. One teenager whispered with a grin, "Grandpa must really love museums." Another laughed quietly. Maybe he remembers when some of this was happening. Jonathan heard them, but simply smiled and continued reading. Near the center of the Innovation Gallery, he stopped in front of the largest glass display in the building. Dozens of fresh flowers rested beneath the exhibit, left by visitors over the years. Inside the case sat an aging metal prototype connected to faded circuit boards, yellowed engineering sketches, and several black and white photographs documenting one of the most influential technological breakthroughs in modern American history. Jonathan quietly removed his glasses and stood looking at the exhibit without speaking. A young museum guide named Sarah Mitchell noticed him standing there for quite some time. Assuming the elderly visitor might be confused, she approached with a warm smile. "Good morning, sir," she said kindly. "Can I help you find another gallery?" Jonathan looked at her and gently shook his head. "Thank you," he replied softly. "I was just remembering." Sarah smiled politely. "It's certainly one of our most popular exhibits." Jonathan nodded. "Yes." After a brief pause, he added quietly, "It took much longer to build than most people imagine." Sarah assumed he was simply a devoted admirer of the inventor whose work filled the display. "Many visitors say the same thing," she replied before walking away to assist another family. Across the gallery, Museum Director Dr. Michael Reynolds had just finished greeting a delegation of visiting university researchers. As he looked toward the innovation exhibit, his eyes suddenly widened. "Is that?" Without finishing the sentence, he immediately walked across the gallery. Visitors stepped aside in confusion as the museum director approached the elderly man standing alone before the display. Reaching Jonathan, Michael smiled warmly before extending both hands. "Dr. Pierce," he said, "welcome back." Jonathan smiled modestly. "It's been a few years." Michael nodded. "Far too many." Turning toward the gathering crowd, he raised his voice just enough for everyone nearby to hear. "Ladies and gentlemen," he announced, "I'd like to introduce the man whose work you're standing here to admire." The gallery became completely silent. Several historians immediately recognized the name. A visiting engineering professor quietly removed his hat. The high school students who had laughed only minutes earlier stared in disbelief. Michael continued, "This is Dr. Jonathan Pierce." He smiled toward the elderly scientist. The inventor whose research made this exhibit possible. Jonathan looked almost embarrassed by the attention. As he gently lowered his weathered leather satchel to the floor, the old brass clasp unexpectedly slipped open. Inside rested dozens of carefully preserved handwritten laboratory notebooks dating back more than 45 years. Beneath them lay a single sealed envelope written in elegant blue ink. Across the front were only a few words. For Jonathan, open this when people finally realized that the greatest invention was never the machine itself, but the hope it gave to everyone who used it. A quiet murmur spread through the innovation gallery as visitors slowly realized who the elderly man standing beside the display really was. Moments earlier, he had seemed like nothing more than another retired tourist. Now historians, engineers, and museum staff looked at him with a completely different expression. "Dr." Michael Reynolds smiled as he gently closed Jonathan Pierce's weathered leather satchel before handing it back to him. "Most people know the invention," he said. "Very few know the person who made it possible." He turned toward the crowd gathered around the exhibit. 46 years ago, Dr. Jonathan Pierce led the research team that developed the first practical emergency cardiac monitoring system, capable of continuously detecting life-threatening heart rhythm changes outside a hospital. Several visitors looked back toward the glass display. Inside rested the original metal prototype, large, heavy, and primitive, compared with modern medical devices. Michael continued, "Today's portable cardiac monitors, emergency response systems, and countless hospital technologies all trace part of their history back to the ideas inside that prototype." A group of biomedical engineering students stared at the exhibit with growing amazement. One quietly whispered, "We studied this in class." Another looked at Jonathan in disbelief. "He's the one who built it?" Jonathan smiled gently. "Not alone." Michael nodded. "That's exactly what he always says." He pointed toward the photographs displayed behind the prototype. Every person standing beside him in those pictures helped solve a problem no one could solve alone. Jonathan looked at the faded photographs for a long moment before quietly saying, "Science is never the work of one pair of hands." The room became silent again. Michael carefully opened one of Jonathan's handwritten laboratory notebooks. Visitors expected to see complicated circuit diagrams and mathematical formulas. They were surprised to find that the first page contained only a single handwritten sentence repeated at the beginning of every notebook. "Never forget the patient hidden behind the data." Jonathan smiled as several students read the words aloud. "Machines measure numbers," he said softly. "Doctors treat people." Michael slowly turned another page. The notebooks were filled not only with engineering sketches, but also with handwritten reflections after long nights in the laboratory. What did today's failure teach us? Which mistake saved us from a larger one? Every successful experiment stands on hundreds of quiet disappointments. A young researcher looked at Jonathan. "You wrote after every experiment?" Jonathan nodded. "Especially the unsuccessful ones." Gentle laughter spread through the gallery. "Those usually taught us more." Michael smiled before walking toward a smaller display beside the main exhibit. Inside rested dozens of letters sent by patients and families over the past 4 decades. Some thanked Jonathan for inventions that had helped save a parent, spouse, or child. Others described lives changed because doctors had recognized dangerous heart rhythms before it was too late. "These," Michael said quietly, "are the reason this became our most visited exhibit." Jonathan slowly picked up one of the letters. "This little girl," he said softly, "she wrote to us 30 years ago after her father survived because of the monitor." He smiled. "She became a cardiologist." Complete silence filled the gallery. At that moment, one of the museum archivists approached carrying a polished walnut presentation case. "Dr. Pierce," she said warmly, "we've kept this safe for many years." Jonathan looked surprised as she placed the case into his hands. He slowly opened it. Inside rested the original engineering identification badge he had worn during the research project. along with the first rejected grant proposal that had nearly ended the entire program before it even began. Beneath those documents lay another sealed envelope, written in the same elegant blue handwriting as the one inside his satchel. Across the front were only a few words: "For the day people finally understand that inventions do not change the world because they are brilliant. They change the world because they help someone live long enough to see tomorrow." The gallery remained completely silent as Dr. Jonathan Pierce slowly lifted the rejected grant proposal from the walnut presentation case. The paper had yellowed with age, its corners worn from decades of careful preservation. Across the top appeared the date from 46 years earlier. Project proposal declined. One sentence had been underlined in faded blue ink. "The proposed technology is too expensive, too experimental, and unlikely to provide meaningful, practical benefit." Several engineering students stared at the words in disbelief. "Dr." Michael Reynolds smiled gently. "History remembers the invention," he said. "Very few people remember how close it came to disappearing before it even began." Jonathan carefully folded the document before placing it back into the case. "The reviewers weren't unreasonable," he said calmly. "We simply couldn't prove something that hadn't been built yet." A graduate student raised his hand. "Did you appeal the decision?" Jonathan smiled softly. "No." The room grew quiet. "Instead, our team went back to the laboratory." Michael nodded. "For another 3 years?" He pointed toward one of the photographs displayed behind the prototype. It showed a cramped basement laboratory filled with homemade equipment, borrowed instruments, and workbenches assembled from recycled materials. "This wasn't a famous research facility," Michael explained. "It was an old storage room the university allowed them to use after normal working hours." Jonathan chuckled. "The ceiling leaked whenever it rained." Gentle laughter spread through the gallery. "We placed buckets beside the oscilloscopes and kept working." Michael carefully opened another laboratory notebook. Every page contained careful observations from experiments that had failed. Beside one circuit diagram Jonathan had written, "Device overheated after 12 minutes. Build another." On another page appeared the words, "Patient safety comes before scientific pride. Start again." One young engineer looked up in surprise. "You never erase the mistakes." Jonathan gently shook his head. "Because they became part of the solution." The audience fell silent again. Michael walked toward the prototype, resting inside the glass case. "Do you know why this machine became one of the museum's most important artifacts?" he asked the visitors. Several people guessed because it changed medical technology. Michael smiled. "Partly." He then pointed toward a small scratch on the side of the metal housing. That mark appeared during the final overnight test before the first successful demonstration. Jonathan laughed quietly. "I dropped a wrench." The crowd smiled. "I thought we'd destroyed 6 months of work." Michael nodded. Instead, while repairing the damage, the team discovered a weakness in the electrical shielding that would have caused unreliable readings in emergency conditions. The engineering students looked at one another in astonishment. Jonathan rested his hand lightly against the glass display. "Our biggest mistake prevented a much bigger one." Complete silence filled the gallery. Just then, an elderly man wearing a dark suit slowly approached from another exhibition hall, walking with the assistance of a cane. He stopped beside Jonathan before extending his hand. "Dr. Pierce," he said warmly, "I wasn't sure you'd remember me." Jonathan studied his face for a moment before his expression brightened. "Mr. Ellis." The man smiled. 41 years ago." Jonathan nodded slowly. "The first patient outside a hospital whose life was saved by the prototype." Many visitors quietly covered their mouths in surprise. Mr. Ellis reached into his jacket pocket and carefully removed a faded photograph, showing himself standing beside his wife and 2 small children. "Those children are grandparents now," he said softly, "because your team refused to quit after everyone else believed the project had failed." Jonathan accepted the photograph with both hands. His eyes filled with gratitude rather than pride. Beneath the photograph, resting inside the walnut case, lay the second sealed envelope addressed to him. Across the front, written in elegant blue ink, were only a few words: "For the day you finally understand that the greatest invention is not the machine you built, but the generations of lives that continued because you never stopped building it." The Innovation Gallery remained completely silent as Dr. Jonathan Pierce carefully opened the second sealed envelope. The paper inside had become fragile with age, but the elegant blue handwriting remained perfectly clear. Jonathan adjusted his glasses and slowly began reading aloud. "Dear Jonathan, if you are opening this letter, Then people have finally discovered the machine. I hope they never forget the reason it was built." He paused briefly before continuing. "Many inventors dream of creating something extraordinary. That is not enough. Before you build any machine, ask yourself one question. Whose life becomes better because this exists?" Every visitor stood without moving. Jonathan turned the page. "One day, newspapers may celebrate your invention, universities may teach your work, museums may place your prototype behind glass. None of those things matter if you ever forget the frightened patient waiting for hope at the other end of the wire." Several medical students quietly lowered their eyes. Jonathan smiled softly before reading on. "There will be moments when funding disappears, experiments fail, and people tell you your idea has no future. Do not measure your work by today's opinions. Measure it by tomorrow's lives." Complete silence filled the gallery. Jonathan unfolded the final page. "Remember this above everything else. Machines never save people. People save people. Machines simply allow compassionate people to do it sooner, better, and more often." Jonathan slowly folded the letter and returned it to the envelope. No one spoke for several long moments. Finally, Museum Director Michael Reynolds stepped forward. "Dr. Pierce," he said quietly, "for years, visitors believed this exhibit honored an invention." He smiled warmly. "Today, they learned it honors a purpose." Jonathan gently shook his head. "No invention belongs to one person." He looked toward the photographs of his research team. "Every engineer, technician, physician, nurse, and patient who believed in the project deserves to stand here beside me." Michael laughed softly. "Exactly why you deserve to stand here." At that moment, the lights throughout the gallery dimmed slightly as a curtain quietly rose beside the permanent exhibit. Behind it stood a newly completed display, prepared without Jonathan's knowledge. Inside a polished glass case rested his faded brown tweed jacket, weathered leather satchel, wire-frame glasses, original engineering notebooks, the rejected grant proposal, his research identification badge, the 2 handwritten letters from his mentor, and the photograph Mr. Ellis had just given back to him. Above the collection, illuminated beneath soft white light, stood a bronze plaque engraved with the words, "The Jonathan Pierce Humanitarian Innovation Legacy," dedicated to the scientist who taught generations that the greatest technology is measured not by its complexity, but by the number of ordinary lives it quietly allows to continue. Visitors slowly rose to their feet in a long-standing ovation. Some applauded the inventor, whose work had transformed emergency medicine. Others applauded the scientist who never forgot the people behind the technology. But those who truly understood what had happened that day realized they were honoring something even greater than an extraordinary invention. They were honoring a man who had spent an entire lifetime proving that the true purpose of scientific progress is never to make history remember our names. It is to make tomorrow safer for people we will never have the privilege of meeting. The story of Dr. Jonathan Pierce quickly spread throughout the scientific and medical communities. At first, news reports focused on the touching moment when museum visitors discovered that the quiet, elderly man they had mistaken for an ordinary tourist was actually the inventor whose prototype stood at the center of the museum's most treasured exhibit. But as physicians, biomedical engineers, researchers, and students learned the full story behind Jonathan's work, the event became far more than a remarkable coincidence. It became a lesson about perseverance, humility, and the true purpose of scientific innovation. 1 year later, the National Academy of Medicine invited Jonathan to deliver the opening address for its annual conference on medical technology. Hundreds of physicians, biomedical engineers, researchers, university professors, graduate students, and healthcare innovators filled the auditorium, expecting a lecture on engineering breakthroughs or the future of medical devices. Instead, Jonathan walked onto the stage carrying only his weathered leather satchel. He slowly opened it and removed the oldest of his handwritten laboratory notebooks. Looking across the silent audience, he smiled gently before reading the first sentence written on the opening page more than 45 years earlier. "Never forget the patient hidden behind the data." He quietly closed the notebook again. "People often ask me what the greatest invention of my career was." He began. "The truth is," he smiled softly, "it wasn't a machine." The audience listened without moving. "The greatest invention was learning how engineers and doctors could trust one another enough to solve problems together." Complete silence filled the hall. Jonathan continued, "The greatest mistake young researchers make is believing technology exists to impress other scientists. He rested one hand on the notebook. It doesn't. Looking around the room, he said calmly, technology exists to solve problems that ordinary people cannot solve by themselves. Museum director Michael Reynolds, seated in the front row, quietly smiled. Those words reminded him of the morning when an elderly visitor had quietly transformed the meaning of an entire museum exhibit. At the conclusion of the conference, the National Academy unveiled the Jonathan Pierce Center for Humanitarian Innovation. Established to preserve the philosophy that had guided Jonathan's life's work, inside the center rested his faded brown tweed jacket, weathered leather satchel, wireframe glasses, original laboratory notebooks, the rejected grant proposal, his research identification badge, the 2 letters from his mentor, and the first prototype that had changed emergency cardiac care forever. Visitors expected the first exhibit to showcase engineering achievements or technical specifications. Instead, they found a single handwritten question displayed beneath soft lighting: who will live a better life because of what you create? Every young researcher entering the center was asked to stand before that question before beginning their first laboratory project. Years later, after Dr. Sen, Jonathan Pierce peacefully passed away at the age of 94. Scientists, physicians, engineers, nurses, and former patients gathered from across the country to honor him. There were no speeches celebrating patents, awards, or scientific fame. Instead, one by one, people quietly placed handwritten letters beside his portrait, describing lives that had continued because one research team had refused to abandon an impossible idea decades earlier. Above the entrance to the Jonathan Pierce Center for Humanitarian Innovation, a bronze inscription welcomed every future innovator with the words that would forever define his legacy: innovation changes the future only when compassion decides where innovation should begin. Those who visited the center often admired the old satchel, the weathered notebooks, and the prototype that had transformed modern emergency medicine. But those who truly understood Jonathan Pierce's life realized that his greatest achievement had never been inventing a revolutionary medical device. It was teaching generations of scientists that the highest purpose of knowledge is not to create remarkable machines, it is to quietly protect remarkable human lives. The story of Dr. Jonathan Pierce soon spread far beyond the halls of the National Museum of American History. At first, people shared the remarkable moment when an elderly visitor wearing a worn tweed jacket was revealed to be the inventor behind the museum's most treasured exhibit. But as doctors, engineers, researchers, and ordinary families learned who Jonathan truly was, the story became much more than an inspiring surprise. It became a reminder that the greatest people in history often spend their lives working quietly, while the world admires only the results of their dedication. In the years that followed, medical schools, engineering programs, research institutes, and museums across the United States invited Jonathan to speak. Most audiences expected him to explain the technology that had transformed emergency medicine. Instead, he almost never began with the invention itself. He would simply place one of his old laboratory notebooks on the table and ask a single question: who are you trying to help? He would wait until the room became completely silent, because if you cannot answer that question, he would continue gently, then no amount of brilliant engineering will ever become meaningful. During his final public appearance, Jonathan walked into the museum after closing hours carrying the same weathered leather satchel that had accompanied him throughout his entire career. Instead of stopping in front of the prototype bearing his name, he quietly walked to the wall, where hundreds of letters from grateful patients and their families had been displayed. He looked at them for several long moments before smiling. "People think this machine is my greatest achievement," he said softly. He gently touched one of the handwritten letters. "It isn't." He looked around the empty gallery. "My greatest achievement is that thousands of families were able to spend one more birthday together because a group of people refused to stop believing that this could work." The museum staff listened without speaking. Jonathan slowly closed his satchel. "One invention can become outdated," he said. "One act of compassion never does." Those became the final public words he ever shared. Years after Dr. Jonathan Pierce peacefully passed away, visitors continued filling the space beneath his exhibit with handwritten notes instead of flowers. Some came from doctors, others came from engineers, nurses, students, or families whose loved ones had survived because of technologies that traced their origins back to his work. Beside the original prototype stood a simple bronze inscription that every visitor paused to read before leaving the gallery. The value of an invention is never measured by the machine itself. It is measured by the lives that continue because someone cared enough to build it. Visitors often admired the prototype, the engineering sketches, and the notebooks that had changed modern medicine. But those who truly understood Jonathan Pierce's life realized that the museum's greatest treasure had never been the artifact displayed behind the glass. It was the quiet reminder that the finest inventions are not created to make their inventors unforgettable. They are created so that countless ordinary people can continue living ordinary lives with the people they love.